Welcome back from the break. Moving on to our next conversation is about cancer, because tomorrow is going to be World Cancer Day. And to discuss on this very important topic is the disease that causes major death in Nigeria. In fact, in about 4 deaths, one is as a result of cancer. And to discuss on this, we are going to have Funsho David, a member, Oncology Pharmacy Practitioners Association of Nigeria, OPAN, and Mrs. Adeshola Clara, Deputy Director, Head of Oncology Pharmacy Unit, National Hospital. And we are going to be looking at the role of pharmacists in closing care gap in terms of cancer treatment. First of all, let's look at what the disease is all about. What is cancer, ma'am?
Cancer is a group of disease, actually, where the cellular material suddenly change. When I say cellular material, genetic makeup of a cell changes or get mutated, and it affects other cells. The characteristic of this cell is they divide rapidly, and before you know it, a tumor is formed and it increases. It has the ability of spreading through the blood or lymph nodes to other parts of the body. And when that happens, it is called tumor or cancer, and it deprives other healthy cells of the body nutrients and some other. Let me not bore you with other.
All right. Looking at talking to a layman like me, where does it actually occur? Is it on the surface of the skin, or at the sub layer of the skin, or it attacks a particular organ in the body?
Wherever living cells are in the body, cancer can occur there.
Okay.
Yes.
Okay.
There are different kinds of cancer, and that's why we call it a group of disease. So there are as many cancers as over 100.
Wow.
There are types in the body.
Wow. And what's the cause, please?
Up till date, cause is not known. However, there are risk factors. What can predispose somebody to it? These factors are grouped into two. We have the modifiable ones, the ones we have control over, and then the non-modifiable ones, the ones we do not have control over. The ones we do not have control over are like age. The older a person gets, the higher the risk of coming down with cancer. Another risk factor is genetics. If one have that gene of likelihood of having that mutation, then that's a risk factor. So also environmental factors. Then the modifiable ones are the ones we have control over. Maybe our lifestyle. There is an association between the use of tobacco, excessive alcohol use with cancer. So exposing or indulging in them can also increase one's risk. Lifestyle, like the kind of food we eat, obesity, have also been shown to have an association with cancer. Therefore, our lifestyle can also be a risk factor.
It's something we should be watching out seriously.
Yeah.
As a member of oncology pharmacy, sir, what's your role in trying to close care gap?
Thank you. And I like the fact that you mentioned closing the care gap, which is the global theme for cancer care in the whole world, and Nigeria inclusive. The role of pharmacists or oncology pharmacy practitioners in closing the cancer care gap is, one, to create access to affordable and innovative medicine to improve outcome of cancer patients. That would mean keeping them alive the longer. One other role also is to support the core care team, the doctors, the nurses, the social health workers, the psychologists, are forming a multidisciplinary team to support cancer care is another role. I will play some role in also advocacy, awareness, and counseling of of patients that are burdened with the cancer disease. So in the nutshell, it's a multidisciplinary team of the core care of cancer patients, focused on creating awareness and access to innovative cancer medicines.
Thank you very much, Ma. Coming to you now, as a pharmacist, are there kind of drugs that you are planning or you have planned to make that will be very affordable to those cancer patients?
Yes, will be my answer.
Okay, that's interesting.
Yeah, because science is dynamic. The production of drug continues.
Yes.
Right now, there are class of drug we call targeted therapies that target the cancer cells, thereby limiting the effect on the healthy cells.
Okay.
That is our goal, because currently the majority of the drugs for treating cancer are chemicals that also affect healthy cells. But the good news is that these healthy cells recover faster than the cancer cells when the drug hits. But the targeted therapies go straight to where you desire. Research is ongoing, so more of these drugs are coming out. And also the fear of patients out there is chemotherapy makes me sick. These other drugs are also formulated into oral form, tablets form, so you may not have to come to the hospital to take your medication. So these are innovations. Drug manufacturing companies, research institutes are going into and coming up every day with new drugs. Yeah. And talking about efforts made to make this drug accessible, because that is addressing the theme of this year World Cancer Day, closing the gap, trying to join voices together and to act. What we are doing currently is to see how these patients with cancer can be helped to cushion the burden they go through, particularly financial burden. So there are lots of initiatives the federal government has put in place to address this.
Because the reason why I asked, because once a patient is diagnosed or being told that he or she is suffering from cancer, they like automatically give up because the treatment is so expensive, and then is, of course, like eventually the final thing is just to die. So some even assume that there is no need for me to go and spend my money, because at the end of the day, anytime soon, it's like it has a short period of survival rate.
Yes, that is always the fear. But we assure people out there and people with cancer that it is not a life sentence. It is curable. And the key is early detection. And that is the advocacy we are sending out there. Whenever anybody notices some signs or any changes that is unusual or cannot be explained, please see your physician. Go to the hospital. Get tested early. That is part of closing that gap. We want as many as whoever come down with the disease, get tested early and have the chance of being cured, pronounced disease-free.
Exactly.
Yeah, so it's not a death sentence. The key is get detected early and get access to treatment, affordable rates. That is the key.
I don't know, at what stage do you come in, because you said it's a multidisciplinary kind of work you do with the medical doctors. At what particular point do you come in to participate in the care?
All right, thank you. So like I said, it's a multidisciplinary team. Oncology pharmacists are saddled with the responsibility of getting access to the medicines, right? Not only the medicines, but the right medicines at affordable cost to the patient. And of course, this comes with counseling also. So the first stage after diagnosis, of course, is the patient needs to see the doctors, gets prescribed for their medication. And of course, oncology pharmacists, one, review the prescription, check if there are any errors and area of collaboration between the doctor or the treatment team, right? And of course, reconstitute where necessary. Farmer Adeshola talked about how some drugs come in different formulation, advice on the best form per age, per disease type, and all that. So oncology pharmacists do all this in the hospital, and oncology pharmacist also doesn't just sit in the clinic or the hospital, and also it comes with different field of specialty. You agree with me that in healthcare, specialization is the buzzword now. So there are oncology pharmacists in different facets of care: administrative, education, clinical oncology pharmacists, and of course the different parts. So these are the areas of collaboration, all geared towards producing that desired outcome and getting the patient the right drug for better outcome.
Thank you very much. Over to you, Ma. We've been talking about cancer. You told us earlier that there are different types of cancer. What is the most common in Nigeria? What type of cancer that is common in Nigeria? And how do you detect it? How early one should detect it?
The most common, not just in Nigeria, but world over, is breast cancer.
Breast cancer.
Yeah, it is breast cancer. It may interest you to know
so
that...
women are the victims.
Not, yeah, I was just going to say that it will interest you to know that a few number among the men to come down with it.
Wow.
Yeah.
1 in 100.
Yeah.
Okay.
Yes.
Okay.
Yeah, so that's the commonest. Yeah. And detecting it can be early. Any woman who is, of course, having the mammary gland, the breast, is taught how to do self-examination. Well, this forum is not for me to demonstrate, but a good number out there who do not know are advised to see, even if it's the primary health institutions, they will tell them how to do the examination. And it's advised they do it average of once a month.
Once a month?
Just once a month. Okay. And do it regularly. Okay. If the lump is detected early, then the chances of cure is assured.
It's assured.
And when I say early, it must really be early, maybe as small as a grain.
Okay.
As the woman palpates, she's able to. Yeah. Of course, it does not end there. The other fear some have is they might cut off the breast. The doctor will assess, particularly the specialist, and know the best line of treatment, because even if you talk about breast cancer, there are different types. Yeah. So detecting it early starts with the woman doing the self-breast examination on a regular basis, and if she notices anything unusual, whether in the shape of the breast, if there is discharge when there is not supposed to be, anything unusual and unexplained should be reported to the hospital.
Thank you very much. At least even if there is no practical demonstration, but a message has been passed across. And then in closing the care gap for this year's theme, what special like program do you have? Is it creating awareness or around the treatment or early detection, that's screening, or what do you have on ground?
Yes, for this year, like you mentioned, one of the activity is creating awareness. Okay. And we are glad you offered us the opportunity to do so.
You're welcome.
On NTA Channel 5. Thank you for that. Other forms of awareness is to let people out there know that it is not a death sentence. We want to increase the awareness of detecting it early. If you see anything unusual, it could even be maybe the toilet habit, there's a slight change in it, please report. Seek medical attention. Any unusual sore, unexplained, painless, the person should report. It could even be ordinary cough that has been for a long time and is not responding to self-medication, please report. We are not trying to say these are signs and symptoms, but we are saying if it's prolonged for a while, medications have been taken, and the medical problem is not resolved, please seek medical attention. This will help in detecting it early, and that's how we can close the gap. That's in the area of detection. In the area of prevention, improved lifestyle is also advocated. In the area of treatment, accessibility to affordable quality medications, programs, initiatives are also available in our health institution.
Sure.
So they can all be accessed.
Okay, okay. Let's take the last question. What's the age range of getting infected with this disease?
Right, thank you. Maybe before I answer the age range, I'd like to also add some words
All
to
right.
what the Oncology Pharmacy Practitioners Association of Nigeria, OPAN, is doing for the year, closing the care gap in accordance with the global theme. And this theme will run, it started last year, it will run till I think 2025, 2024. So it will continue next year. One of it, like you said, is this forum, creating awareness. The other is around advocacy and partnership, right? The association has over 150 members across Nigeria, right? And of course, collaborating with other pharmacists globally, Ghana, West Africa, and globally. So the association is also open to collaborate with the healthcare practitioners and policymakers, right, to create access to medicine. The Federal Ministry of Health has some very laudable programs to create access to medicine, and OPAN is ready and already collaborating in making sure that at the last mile of getting access to these medicines, they are ready to serve and also work to make these programs successful and sustainable. And to your question around age range, I mean, strictly, cancer can happen at any age.
Okay.
There are childhood cancers today, right? There are hematological blood cancers that affect children. But again, usually the older the person gets, the higher the risk. Additionally, talked about risk factor. Age is part of it. So the older a person gets, the higher the risk of getting cancer. But today, there are cases of pediatric cancer which happens in children. So any age group can be infected by cancer.
So it's left for us as parents to look at how we can prevent it right from the childhood level, not only when we are getting older. What's your parting words to our viewer?
Yes, is the key to the treatment or a cure of cancer is early detection. So my parting word is, please get tested. Do your, if it's routine yearly blood work test, please don't ignore it. Do it.
And to you?
I mean, to me, again, to Nigerians and everybody out there, cancer is not a death sentence. Early detection saves lives, and there are medicines, there are treatments available, and the gap is getting closer year by year. What is available in the world, in the advanced world, is readily available here also at cost across treatment of cancer. So again, early detection saves lives. You have oncology pharmacists. You can also reach out to them wherever you find one to also support the care.
Thank you very much, Mr. Funsho David and Adeshola Clara, for informing us. Even I myself have been informed, not to talk of our viewer there. We've been talking about cancer, and this year's theme is about closing care gap, and they have done their bit, and they have been doing, and they are going to continue. So please, what they said is try and get tested, and once you have been tested either positive, go for treatment as soon as possible. We are closing this conversation now, but after the break, the program continues.